Hey, good morning. Today is September 16th. Another 90 days before the NEET PG. I thought that I shall give you some short videos which will help you to do a quick revision of the concepts. So, this is Dr. Murli Bhardwaj, your everyday roommate, YouTube mate, WhatsApp mate, and a classmate for the NEET PG preparation. तो शुरू करेंगे बढ़िया. So, yes. Uh, yes. Today we'll talk about two topics: hemochromatosis and Wilson celiac disease. These are the favorite areas for the examiner. Now, doctor, yes. If you look at the hemochromatosis, what is the commonest mutation? C28 to Y. You should remember it is the chromosome 6 which is having the mutation. And what is that gene called as? HFE gene. And where do you see in the case of the males, not in the case of the females, because females are having menstruation, they have a way to let out the iron, whereas males don't have that. So there's a reason iron deposition is very common in them. Now, the serum Fe, iron, typically is elevated more than 300 milligrams per deciliter, is what examiner is going to expect you to remember the numeric. What is a very sensitive parameter for the hemochromatosis, doctor? The serum transferrin saturation is considered to be very sensitive. And whenever the value of it is more than 50%, that is an indication for you to go ahead and do the evaluation for the hemochromatosis. And the ferritin, it is more than 1000, normal value is less than 200. And hemochromatosis means urinary iron excretion is markedly increased. How much? More than 2 milligram per 24 hours. And deferoxamine is the iron chelating agent which you will be using, which is a very classical question. If you happen to use deferoxamine, if you give a injection of deferoxamine, the urine iron excretion become markedly increased. This is considered to be a diagnostic test. When the iron content in the liver is significantly increased, MRI will reflect it. But any given day, what is the favorite NEET PG examiner question? Bhaiya, what is the gold standard test in the diagnosis of hemochromatosis? What is going to be your answer? Liver biopsy. Now, liver biopsy once upon a time was a gold standard, but nowadays we don't do it routinely. Only if you want to know whether there is any cirrhosis, then we are doing the liver biopsy. We do a gene assay to check for the C282Y. The mutation of 282Y is the one which you are trying to test. Now, venesection. What is the preferred therapy, doctor? Venesection is the preferred therapy. And when you do venesection to treat hemochromatosis, how much you are removing? Around half liter per week is what you are removing. We also give desferoxamine infusion, which is a iron chelator. Now, what will happen because of hemochromatosis? This iron can go and infiltrate in parathyroid. That's the reason there is a development of hypoparathyroidism, is what you should remember. Now, in hemochromatosis, this iron can go and deposit in the joint. That is the reason arthropathy can occur. Iron can go and deposit in the skin, and it will leave a brown discoloration. It looks as such melanin got deposited. Now, hemochromatosis can lead to cardiomyopathy. So, restrictive cardiomyopathy is a consequence of hemochromatosis. And Whenever the ferritin is more than 2000, that is the level at which the cardiac damage is typically seen. So finally, what are you going to remember for the tomorrow's exam, doctor, about the uh, hemochromatosis? What are you going to remember? You should remember that in the case of the hemochromatosis, C, C is for carbohydrates, carbohydrates. That is, there is diabetes mellitus. Please don't forget. C is the color, color. That is, skin undergoes darkening. C is for cirrhosis, cirrhosis. And C is coitus. Those who have hemochromatosis, typically the iron deposition in the pituitary will cause a decreased FSH, decreased LH. Because of that, because of the pituitary dysfunction, there is a problem in the testis. Testis cannot produce testosterone. So this kind of a hypogonadism which occur because of the problem in the pituitary is called hypogonadotrophic hypogonadism is what you have to remember. So C is coitus. C is calcium pyrophosphate deposition, pyrophosphate deposition, right? So that is, there is a development of pseudo gout in the patients who are having hemochromatosis. Finally, there is a cardiomyopathy, more commonly restricted type, cardiomyopathy. Then there are conduction abnormalities, conduction abnormalities, conduction defects occur. Another C finally is C28-2Y mutation. C28-2Y mutation is what you have to ultimately remember. So now, doctor, let's come back to the next important condition, that will be Wilson's disease. Once more, इसमें भी जरा बट्टी मारने वाला चीजें होते हैं. एवरी टॉपिक के ऊपर 10 पॉइंट्स फटाफट रिवीजन करना है, ठीक है? सो डॉक्टर, typically it is the ATP7B gene which is abnormal in Wilson's disease. Chromosome 13 is the Wilson's disease. It is autosomal recessive, you are not going to forget. You find KF rings, but not always. Examiner will ask you in tomorrow's exam, do you find it always? No, we don't find it always. Abhishek is asking a very good question. Kindly share the WhatsApp group link. भैया WhatsApp group link आपको नीचे रहता है, ये वीडियो के नीचे WhatsApp group link अवेलेबल है. वो लिंक को आप यूज करके you can be able to join yourself and you can also share it in your classmates WhatsApp group, and that gives opportunity for lot of new people to come and also join the WhatsApp study group, right? फिर भी आपको नहीं मिल रहा है बोले तो please call our helpline 9000-868-356. Now, what is the best test for the Wilson's disease, doctor? Hepatic copper concentration more than 250 microgram per gram of dry weight. Typically, there is a low serum copper, but high urine copper excretion. This is where a lot of people confuse. Wilson's disease means it is a copper overload state. They think serum में भी high होगा, high नहीं होगा. Serum में low होगा, urine में high होगा. That is what you need to remember. Now, there is a low liver production, low production of ceruloplasmin. That is the whole problem. That is the reason ceruloplasmin is less than 20 is what you have to remember. Now, the copper deposition can occur in the liver, it can occur in the kidney, And that is the reason it can affect vitamin D metabolism. That is the reason, very important point. Many people miss it. Wilson's disease is one of the cause for the osteomalacia and osteopenia is what you have to remember. Now, doctor, let us talk about celiac disease. Celiac disease may folate levels are normal, but not B12, not B12. Whereas in case of Crohn's disease, both the folate and also B12 are decreased. This is one of the favorite testing point in the NEETPG exam. Dermatitis herpetiformis with all that rash on the extensor surface in celiac disease, you should not forget. Is dermatitis herpetiform rash is pruritic or non-pruritic? It is pruritic. It is associated with HLA, DQ, DQ, DQ2, DQ2. Please don't forget. Now, anti-endomysial antibodies and celiac disease. Please don't forget. Celiac disease is a gluten-sensitive enteropathy. And where do you find gluten, doctor? Wheat, rye, barley. Wheat, rye, barley is the place where you find the gluten. And if you do the biopsy in case of the celiac disease, one of the very important MCQ in the pathology in NEET-PG and FMG exam, what do you see in celiac disease? Hypertrophied crypts of Lieberkühn. Crypts are hypertrophied, villi are atrophied. Confusion nahi rehna bhaiya. Hypertrophied crypts of Lieberkühn, villi are atrophied. There is a degeneration of the surface epithelial cells, and very important, intraepithelial lymphocytes are basically increased. If you do jejunal biopsy, what will it show? If you give a gluten-free diet and after that if you do jejunal biopsy, then there is an improvement. Always they say no, the taste of pudding is known only by tasting. लड्डू मिठास है बोल के कैसे बोल सकते? लड्डू खाने से बोल सकते. वैसा ही सिलियाक डिजीज है बोल के कैसे बोल सकते? ग्लूटेन फ्री करो डाइट को और जजनल बायोप्सी रिपीट करो, ये पूरा हाइपरट्रोफाइड क्रिप्स ऑफ लाइबरकन नॉर्मल हो जाएगा, विलस फिर ग्रो हो जाएगा. सो दैट रिवर्सिबिलिटी इज ए साइन ऑफ डायग्नोसिस, इज ए डायग्नोस्टिक साइन. एंड सिलियाक डिजीज हमको क्यों डर लगता है? क्योंकि गैस्ट्रिक एंड स्मॉल बowel malignancies are increased in celiac disease. Dapsone, sulfapyridine are the primary medications to treat it, and especially dermatitis herpetiformis. Initially, you will use dapsone. It's very difficult to tolerate the dapsone. इसलिए हम sulfapyridine is the one which we will be substituting. Next condition, doctor, 10 minutes में एक topic फट खत्म कर देना. That is how you should do the revision. Whipple's disease. You have to do small bowel biopsy to confirm it. What will it show? Large foamy PAS positive macrophages. PAS positive macrophages which are large and foamy in the lamina propria. Whipple's disease mainly affects the men between 30 to 60. Tropharema whippli, and Whipple's disease. And what are the symptoms? Diarrhea, inflamed painful joints, fever, skin darkening, etc. So Whipple's hota hai common topic for gastroenterology guys and rheumatology guys because it lead to painful joint and it lead to diarrhea. There is a severe malabsorption and that will lead to weight loss along with fatigue, and there is also a weakness caused by anemia in case of the Whipple's disease. So how are you going to treat Whipple's guy? You have to give tetracycline because what is the organism? Tropharema whippli. To kill that, you have to give tetracycline, cotrimoxazole, penicillin, any of them can very much be used. Now, doctor, let us quickly go to the quick way of remembering this important topic of the Whipple's disease. What are the most important thing that you need to remember about the Whipple's disease? फटाफट बोलो. You should remember the spelling of Whipple. अगर spelling of Whipple याद है तो सब भी याद रहेगा. There should be some easy way, interesting way of doing the revision. Okay. W H I P P L E. W होता है weight loss. बराबर. H hyperpigmentation. Hyperpigmentation of the skin. I होता है infection with what? Tropharema whippli. P होता है pass positive granules in the macrophages. कहाँ रहता? Macrophages में. P होता है polyarthritis in Whipple's disease. L होता है lymphadenopathy. E होता है enteric involvement. There is an involvement of enteric involvement. And Whipples है ना, Whipples बोलते हैं. Yes होता है steatorrhea. Steatorrhea is what you have to remember. So that is the story. Weight loss, hyperpigmentation, Tropharema whippli, PANS positive, polyarthritis, enteric involvement, steatorrhea. That is the Whipples. So that is how डांस करते करते पूरा 953 टॉपिक्स का रिवीजन कर देना. एवरी टॉपिक के ऊपर आपके काबू में रहना है. 10 पॉइंट्स आपके हैंड में रहना है. सो डॉक्टर्स, you all have to help me to make this mission become a big time mission. We want to have पूरा दुनिया हमारे साथ व्हाट्सएप में मिलके पढ़ना है. So because there are so many commercial coaching programs, but really they don't do much good unless you are self-motivated. So that is the reason, to make you self-motivated, we have a wonderful NEETPG WhatsApp study group. There is an invitation link under this video. Please post it. In all your हर एक को 150 classmates का batch रहता है MBBS में. So please post that invitation link in the classmates, आपके seniors groups में and your junior batches के groups में डालो, and make more number of students to also join our 24 hours WhatsApp study group. Every day we have a discussion of almost all 150 to 200 MCQs in our WhatsApp study groups, and you send a screenshot of that, and I promise you that our team will send you back 120 pages PDF of the orthopedics quick summary notes. PDF आपको भिजाएंगे 40 high yield topics का, if you happen to post it in your classmates groups. So subscribe to onlinembbs.com video library. 600 hours of video lectures, 2 lakh PowerPoint slides, 30,000 MCQs discussion, 953 high yield topic discussion, full scale grand test discussion every week, and every day new video lectures added and live online broadcasts. All you will basically get it. Call 900868 356 to join. Good luck for your preparation. Thank you.